Hello, thank you for registering for our Common Ambition Programme webinar. We've had fantastic levels of interest in the programme and over 1,200 people have registered for this webinar, including, in fact, my grandma. So a quick shout out to Joan up in Hull. We'll start with a quick introduction to the programme team. So I'm Ollie Smithson. I'm a programme manager on the team working on Common Ambition.
And hi, I'm Rosie Graham. I'm also a programme manager in the improvement team at the Health Foundation working on Common Ambition. And together we also work with our colleague Sarah Henderson, who's the Assistant Director of Improvement. Hi, so I'll start the session by just giving everyone a bit of an overview about the Health Foundation. So the Health Foundation is an independent charity committed to bringing about better health and healthcare for people in the UK. And Ollie and I both work within the Improvement Directorate within the Health Foundation.
Great. So the reason why we're registered is to talk about our new funding programme, Common Ambition. So Rosie will give a quick run through of how we're going to structure this webinar.
Yeah, so on your screens, you'll see our timeline for today. So we've got about 15 minutes to do an introduction to the Common Ambition programme. So we'll be running through some of the key points around the programme. We'll then spend about 15 minutes answering the frequently asked questions that we've been getting through the mailbox, through some of the events that we've been holding, and also from some of yourselves who have shared some questions with us in advance of this recording. We'll then also go on to give a bit of an overview about how to write a strong expression of interest, and then the practicalities about how to actually apply.
Great. So I'm going to start with the introduction to our new programme. So we launched Common Ambition on the 18th of February. So if you haven't seen our shiny new bright orange guidance, then please have a look on our webpage. The aim of the programme is to support 5 partnerships across the UK. So that includes Wales, Scotland and Northern Ireland. And we'll be providing funding to up to 5 teams of between £300,000 and £500,000. And we think £500,000 is really the upper end of the possibility for funding. So most of the projects we hope will come in at around £300,000 to fit within budget. And as well as 2 to 3 years worth of funding, we'll be providing the teams with tailored support packages, which could include coaching, training, facilitation, and learning events. And the connecting thread between all 5 or all up to 5 of the partnerships that we fund will be that at their heart, they are enabling collaboration between members of the public and healthcare professionals in order to deliver improvements to care. So first of all, I'm going to give you a bit of background about how the Health Foundation developed the new Common Ambition programme. So for a number of years, the Health Foundation has been interested in the concept of learning healthcare systems. There's a bit of a wordy definition here from the Institute of Medicine. In simple terms, a learning healthcare system is one that learns from and improves with every contact it makes with a member of the public. So there's been a lot of efforts in this area around how data from patients, large patient data sets, can be applied in systematic ways in order to drive improvements to care, so utilising technologies and AI to help drive improvements. But there's been less focus, we think, on how the skills and experience within the community and the public's knowledge can be harnessed in a more systematic way, so that they can work alongside healthcare professionals and researchers in order to make improvements to care. So with that as a start point to the new programme, we spent 2019 doing some design and scoping work. This involved making a number of small awards to people whose work we're inspired by. So that's included I was working with the National Children and Young People's Diabetes Network, who are doing some fantastic work with parents and young people with type 1 diabetes in order to allow them to work with clinicians in order to help improve their care. We've also run a series of events and workshops with members of the public, healthcare professionals, academics, and other system leaders in order to make sure the work that we're doing really resonates with different audiences, and that the language we're using around this, this piece, especially the language around patients, co-production, really makes sense to different audiences. In addition to that, we've commissioned some research. So we commissioned a rapid evidence review on the conditions needed for members of the public to work alongside healthcare professionals in order to improve services. And I think that really highlighted that there are some gaps in what really makes co-produced care successful and how patients can work most effectively with clinicians. So where we got to in that scoping phase was deciding that rather than really focusing a programme on specific areas of healthcare, that we'd actually keep the programme very broad and instead focus really on that co-production piece. So the aim of the programme is to create collaboration between those who are using healthcare services and those who are delivering them. And all the partnerships we fund must have that at their heart. And whilst we're not prescribing any buckets of potential topics for people to make submissions in, we think that the partnerships we fund are likely to fall into a couple of key categories. So the first is partnerships that will improve care for people with specific conditions. So the National Children and Young People's Diabetes Network is a good example of that. And another would be partnerships which are looking to improve healthcare in a particular place, that can be geographically, or for a specific population, so more demographic focused projects. Our key tips around this would be that the partnerships we fund, it could potentially be a huge program, this, so we focused it in some ways, and one of those ways that the partnerships we fund must be looking to improve healthcare services, that's services delivered by the NHS, rather than talking about improving health more broadly through the improvement of community services, for example. There must be a focus on NHS services. And the second tip would be that the role of the public must be absolutely fundamental to the partnerships that we're funding. And so we want to move far beyond in this programme the standard sort of consultation work that often happens around the start of improvement projects to a much more embedded way of working with members of the public. I'm going to hand over to Rosie to give a quick overview of the structures of the partnerships we're going to fund and why we think it's helpful to structure partnerships in this way.
Great. So what we're looking for really as the core partnership is, as you can see on the screen, we've got the voluntary or community sector partner and the healthcare partner and the learning partner. So I'm going to talk through each of those in turn to give you a bit of an idea of what we're looking for in each of those areas. So the core partnership has to be 2 or more organisations working together to improve healthcare. We're not specific again about the number of people, the number of organisations that are in the core partnership. So it's more of an encouragement to think about who is actually at the core of that partnership and who is supporting around it. So the 2 groups we've got here are the voluntary community sector partner and a healthcare partner. So they need to be collaborating between those who are using services and those who are delivering them, as Ollie mentioned earlier. Through that kind of core partnership, we'll also look for one of those organisations in the core partnership to be the lead organisation, and we'll go on to some of the detail of what that means later. Amongst that core partnership, we're also looking for a learning partner. So this is the organisation that will be capturing learning, looking at measurement and evaluation, kind of demonstrating the impact of the work that the partnership's delivering. We haven't been too descriptive of what that learning partner should be. So for some organisations, they may be embedded within an organisation already, and for others, they may be another organisation that's coming to the partnership. So we'd encourage you to think about what capabilities and skills you have within your own organisations and whether or not that learning partner is more appropriate to be from within an existing organisation or to bring in another organisation to be the learning partner. We'd also we'll have the core partnership, and around that we'd encourage you to have other organisations involved. So we're not limiting our expectations to just having one or two organisations involved. So including other organisations such as commissioners, local authorities, social care organisations could really strengthen the partnership. And when you're thinking about applying, I'd also encourage you to be quite clear about who's in that core partnership versus who might be involved in the project supporting around it. So that there'll be a bit of a difference in terms of the involvement of the organisations, but being really clear about who's in that core voluntary community sector partner, healthcare partner, collaboration at the beginning.
Yeah, and I'd just add that we think the role of the voluntary and community sector is absolutely vital for this programme, and that voluntary and community sector partners will provide a fantastic way of reaching different members of the public that we potentially couldn't reach through just funding healthcare organisations, and bring different skills and knowledge to the programme that we're really excited to see.
Great, so I'll just go into a little bit more detail about who the learning partner is. So we would expect there to be one for each of the partnerships. They'll be capturing learning specific to the project that partnership is delivering, and really looking to measure change and demonstrate impact from the work. So our expectation is that the learning partner will be, as I said, measuring local impact, reflecting on how successful the organisations involved are collaborating, and capturing experiences of people involved. So members of the public, healthcare professionals and researchers. They're looking at how people are kind of working together, as well as evaluating the impact of the work that's happening. So all proposals must have around 10 to 30% of their budget spent on measurement and evaluation. So to give an idea of the scale of work that we're doing there, I think that's a good indication that we take this very important. We think this is very important for the success of the programme that we were doing. We'd encourage all of the local learning partners to think both about formative and summative evaluation. So formative being throughout the programme, feeding in learning as you go to help develop and improve as you go, and then a summative, which is an evaluation that's done at the end of the programme, looking back over the whole time. So it's a slightly different viewpoint, but having both that learning as you go and then a kind of summary and review at the end, we think would be really important. And some examples of who learning partners can be. So I said before, they can either be embedded within one of the core partnerships that are forming, if you have those skills and capabilities from within that organisation. And if not, you might want to look at organisations like universities, or if you're in England, academic health science networks, or there are organisations that do kind of research and evaluation specifically, so kind of looking out at what's available if you've not got those skills from within. So I'm just going to cover the programme level evaluation, which is connected to the learning partner. So each of the projects will have their own learning partner and their own evaluation of their projects. And then sitting across all of the projects that are funded, so the 3 to 5 partnerships, we'll also be doing a programme level evaluation. So the Health Foundation will be independently contracting an evaluation for that. And the key things that we're looking for through that programme level evaluation is what makes collaborative improvement successful, and what are the lessons for the healthcare system. So drawing learning from all of the teams that we're partnerships that we'll be working with to think about those questions around what makes successful partnerships. So drawing on the learning from each of the teams. So there's a really nice level of kind of evaluation going into this program. So each team will have one, and then the program level one sitting above it as well.
Great. So what are we actually looking for in applications? So I've paraphrased these straight from the Call for Applications guidance, which is on our webpage. So please have a look at these criteria and in detail before applying, and also there'll be the same criteria that are used throughout the application process, so not just in the expression of interest phase, but throughout. So we've touched on a lot of these already. A relevant and important healthcare challenge is obviously really important for all funding bids to the Health Foundation. So this programme, that's certainly still the case. And again, I'd encourage you to think about a couple of things. The first is that this is about healthcare service improvement. So there has to be a focus on NHS services. And the second is that through this programme, we're really interested in whether the approach that we're looking to fund can help tackle inequalities faced by those accessing healthcare services. So think about the inequalities angle of the work that you're proposing and where it might be able to benefit those who are currently poorly served by current healthcare services. The second, I won't go into in too much detail because we've talked about this quite a bit already. So this is a programme fundamentally about co-production of healthcare services. So really bringing in members of the public throughout the programme and throughout your partnership's work. So not just in the kind of co-design of the initial idea, but embedded collaboration throughout the delivery of the project. We're not looking for work to start completely from scratch. We realise that these cross-sector partnerships are difficult to form and take a long time to form, so we'd expect there to be a level of maturity through the partnerships that we're funding, and some track record of delivering on service improvement projects together. Again, Rosie touched on this nicely in the last couple of slides, but we want the organisational structure of the partnership to make sense. We want the organisations involved to complement each other and to be able to bring new skills and ways of working that benefit each other. And finally, again, as Rosie touched on, we're looking for really strong measurement and evaluation plans. So that would be a really important part of the programme. And what do we actually want to achieve through this programme? So these are a few high-level impact goals that we've been working on with our research team to understand what we might achieve through the programme, and just thought it would be helpful to lay it out in terms of a few key audiences for this work. So for the public, obviously there's a fantastic opportunity for the public to be more involved in designing and delivering improvements to healthcare services. For healthcare professionals, I think there's a great opportunity to develop skills in co-production and to better understand how they can most effectively work with patients and the public, particularly those that have potentially engaged less with healthcare services and have poorer experiences of healthcare. And kind of a bit higher level, we're thinking about how we can, through this programme, create a better understanding through the research and evaluation work that we do of how the public can contribute to improvement of healthcare, and that will influence people making decisions about funding for this type of work. And finally, we think it's a great way to help improve healthcare fundamentally. So especially for those who are currently poorly served by current healthcare services, we think there's a great opportunity to improve the quality of healthcare and the outcomes that people who are served by those healthcare services have. And what can we offer to you guys? So we've talked a bit about a few of these things. So with all of our funding programs, we try and create an overall program support, which includes a series of events which bring all the partnerships together, and we'll hope to foster a learning community amongst the partnerships. Obviously, there will be a lot of organisations involved in this programme, so I think building those strategic connections between partnerships will be a really great opportunity. And on an individual partnership level, so as well as the funding of between £300,000 and £500,000, which will be awarded to the lead organisation for up to 5 partnerships, we will also provide a tailored package of support. After we've made the awards, we'll spend some time working with each of the partnerships to look at what their needs are in this area and help design packages of support, which could include coaching, training, facilitation and learning events. And that package will be separate from the grant and worth between £30,000 and £50,000. We'll stop there on the programme introduction, and we've had a lot of questions from people about the programme and particularly around things that they felt haven't been covered in the overall guidance. So we've picked out some frequently asked questions, and apologies if we don't cover every single question that was sent in, but as you can imagine, we've had quite a few. So we've had to select ones that are being most frequently asked, and if we don't cover your question in this session, then please do get in touch with us and we can cover it separately.
Great, so I'm going to start with a question that we've received a bit through the mailbox and also through some of the events that we've been running. So the first question is, what health outcomes are you looking to achieve for the public through this programme? So I think this question's come from the fact that we've kept the programme quite open. So we're not specific about the health outcome that we're looking to achieve through the programme. So we're hoping that each of the health outcomes will be specific to the partnership and most relevant to the partnerships that are putting in the bids. So we haven't specified that, so that's definitely very much open. But what we will need to know through the expression of interest is for you to really make clear what your partnership is hoping to achieve. So being clear about what your healthcare challenge is and the impact you're hoping to achieve for which beneficiaries. So although we're not being specific about what we need to see, we need, through the expressions of interest and as the application process goes on, to really be clear about what each partnership is hoping to achieve. So I think there has been a bit of confusion just because we have kept it open, but hopefully that will mean that the partnerships will be coming together to do this for the outcomes that are most relevant for the populations that they're looking at. So we've had a bit of a cluster of questions. I'm going to address 3 of the most common ones about specifically about how the partnerships work. So how mature does the partnership need to be? Does the partnership need to be formalised? And what kind of scale are you looking for? So I'll kind of break that down over those 3 areas. So in terms of maturity, as Ollie mentioned, we're looking for partnerships with an existing relationship, so building on work that they may have already done, or if they've got a kind of record of working together, it may be a new piece of work, but that existing relationship has to be there. So we're not looking to support partnerships which are starting from scratch, so forming for the first time to submit a bid for this.
I think just to add to that quickly, that doesn't, for example, if a few of the organisations that want to be involved in a proposal have worked together in the past, but then another hasn't, that doesn't exclude a new organisation from being added to a partnership. But at the core, there needs to be some evidence that the partnership has some experience of working with each other across organisations.
Yeah. And in terms of maturity as well, so we will be accepting applications from partnerships that have either funding already in place or other bids going on. So our condition on that is that the funding can be complementary, but it can't be conditional on another funding application or another piece of funding, for example. So where multiple funding is involved, we will need to be able to clearly understand what the support from this programme will be bringing to the existing work. So if you do have other pots of funding or other support from elsewhere, being very honest about that, and then explaining quite clearly how this work will add to that or how it will be different is really important. So very open to be building on top of existing work to kind of progress things. I think where we have cases where a partnership might have multiple funding, we'll have conversations with that partnership to really understand potentially competing priorities. So throughout the programme around events and reporting, just to make sure that if you do have multiple funding sources, that you're not overburdened by things like reporting. So we'll have conversations with people who are in that position more specifically as we get further down the application process. In terms of how formal the partnership needs to be, in the expression of interest phase, we don't ask for any proof of how formal a partnership should be. So as we've said a couple of times, we're looking for existing relationships and evidence of that existing relationship. But the formalisation, so intellectual property agreements or governance arrangements don't need to be outlined specifically in the expression of interest. But we would encourage you to be having those conversations now, if you haven't already, in order to get to the point where you have got formalisation of those relationships, say through a partnership agreement, and we'll be much more specific about that in the later stages of the application in terms of the formalisation of that partnership. Is there anything you want to add on formalisation?
Yeah, I think.
Great. And then the last one I wanted to cover in this area was the scale of work that we're looking for. So again, we've had quite a few questions about this because we haven't been specific about the scale that we're looking for. So we haven't set an exact number of beneficiaries or patients in the service or a catchment area, for example, and a specific number. What we would expect is the scale to be appropriate to the work that the partnership's aiming to achieve. So large enough that you're able to understand the impact of the work through the measurement and evaluation that you're doing. I think we're open to looking at different scales, but each of the partnerships will need to put their case forward for why you've chosen that particular scale of work. So examples of this, as Ollie mentioned earlier, could be the a national network of patients and parents with a clinical network, or it could be something more place-based, so in a particular hospital trust or CCG, STP, or with a particular community region or a condition-specific community to look at. So we can be quite broad on this, but really being clear about why you've made that decision on the scale that you're looking to work with your partnership.
And I think to add in on the scale point, if a partnership was proposing work with a group of patients who experience very poor health outcomes and really aren't being met by current services, I think that could potentially be a very small focus group of patients, and a partnership could be looking to develop during the funding period an approach of working with that group, that members of the public group, in order to develop a scalable approach. So I think the reason why we haven't been prescriptive on what scale of work, what size of geographical area, or what number of patients you need to be working with is for that reason, because we want to give some flexibility around the types of proposals that we can get.
So we've had a couple of questions about the role of researchers in the programme. And I've kind of touched on it before as in an earlier slide around the learning partner. So I think we think the main role of researchers would be in the learning partner, but that's also not exclusive. So they could also be part of the core partnership or even the lead organisation. So I'll go into a bit more detail about who can lead an application shortly, but research could either sit within that core partnership, be a lead, or be a learning partner. So it could be quite broad, but we'd just like to reiterate that this isn't a research call. It is very much a improvement call for funding. So just bear that in mind in terms of where researchers will be working within your partnership.
Yeah, and whilst this isn't a research call and it is specifically around improving services, research will play a key role in driving those improvements to services. So understanding the impact the partnership is having throughout the programme, and developing some reflective practice whereby as the partnership progresses, it can adapt its ways of working with members of the public and its approach to achieving its goals. So embedded research will play a really important role in partnerships that we fund.
So as I just mentioned, I'll go through a bit about who can lead an application, and also we've had quite a few questions about can I be part of more than one application, so I'll cover those both together. So in terms of starting with being part of more than one application, it is completely fine to be part of more than one organisation, but we would encourage you to only lead one. So thinking about the capacity that you have to deliver on more than one project is important as you're going through this, but each of the lead organisations can only submit one application. So being more than one, yes, but leading can only submit one application for leading. And in terms of who can lead an application, for practical reasons, we do have to have a lead organisation, and that organisation must have the capability to hold the formal award agreement with the Health Foundation, to be able to hold funding and also arrange any subcontracting that may need to happen with the funding to partnership organisations. So we can't split awards across multiple organisations. We can only fund and have a kind of formal agreement with one. We recommend that the organisation that will be spending the majority of the award funding is the lead partner, just in terms of the practicalities around the subcontracting. It makes it a lot easier if the funding is sitting and the award agreement is sitting with the team that is spending the most. So the lead organisation can be any of the organisations that make up the core partnership. So either the voluntary or community sector partner, the healthcare partner, or the learning partners, including universities. So yeah, it can be any of those. But we'd encourage you to think about who is the most appropriate one to hold some of those more kind of things with us. There will be an eligibility check on all applications to ensure that applications are from genuine organisations. So if an application is not from a genuine organisation, just a kind of collective of people, that won't be able to get through eligibility, and your expression of interest won't be assessed for the content. It will just stop at the point of eligibility. So make sure that you are applying on behalf of an established organisation. Yeah.
Great.
So just got a couple more questions to go through. So we've had a couple of questions about how the expressions of interest will be assessed. So there's a couple of phases to the application process. The first one being the expression of interest phase, which is the one that we're in currently. When that closes, there'll be a review of all of the expressions of interest. First through an eligibility check, as I mentioned, to make sure that some of the core things that we need from a partnership, so the organisation, for example, meet our basic eligibility criteria to be able to deliver to give funding. And then they'll be assessed against each of the criteria that are set out in the call for applications. So we've broken down into those 5 questions that we looked at the beginning, and then in the call for application we've given pointers under each of those, so what we're actually be looking for. Those assessment criteria will be used throughout the whole application process. So when we kind of approach people to put in their full application, we'll be using the same criteria. But obviously we're very aware of the length of the expression of interest, and so we'll be proportionate when we're assessing. That we'll still be looking at those criteria, but being proportionate based on the amount of information that you are able to provide through an expression of interest. So the expression of interest will also be reviewed by staff at the Health Foundation through a 2-part process. So there'll be 2 people reviewing each of those applications independently of each other. So there'll be a first review, and then that will go through to a second reviewer who is closer to the programme as well. So there'll be 2 people reviewing each application to really make sure that fair decisions are made about how we progress through the later stages of the application.
Fantastic.
Right. And then we've just got one last question that we wanted to cover today. So what are the difference and similarities between the Common Ambition programme, so the one that we're talking about today, and Healthy Communities Together programme? So the King's Fund, together with the Big Lottery Fund, are currently have a call for funding as well, which is called the Healthy Communities Together programme. And so we thought it might be helpful just to lay out some of the differences and similarities between them, as they're both open along similar time frames.
Yeah, and we're aware that these programs are in a very similar space, and we're in conversations with the King's Fund team about the work that they're doing, but they are separate programs, even though they have very similar timelines. We'd encourage you to look at the calls for both programs, because we think certain proposals will be more appropriate to one over the other. A couple of key differences between the two programs. So the first I'll mention is that Common Ambition is open for applications from across the UK, so including Wales, Scotland and Northern Ireland, whereas Healthy Communities Together is just for projects in England. So that's the first key difference. And the second one I'll mention is about the approach we're taking to programs. So whilst both programs are looking to fund partnerships between the NHS and voluntary and community sector, the King's Fund programme is really focused on the contributions that the voluntary and community sector can make to improving healthcare, whereas we're, through Common Ambition, really focusing on the contribution that members of the public can make, working alongside healthcare professionals to improve healthcare, as supported by partnerships between the NHS and the voluntary and community sector. So there's a bit of a difference there in the aims of the programme, and public involvement in the programme is a much more important part of the work to us than maybe the Healthy Communities Together programme it is to them. So that's a slightly different angle that we're each taking, but we're aware that these programs are on very similar timelines, and we hope that as we've selected and the awards get going, that we'll be able to build some really good links between the two programs, which will help enhance the impact of both programs.
And I just sort of to add to that, we're connected with the team delivering Healthy Communities Together programme, so just a bit of assurance to people looking to apply that we are connected. We are doing connected work. I thought it might just be helpful to read out the Healthy Communities Together kind of funding programme statement as well, which might help give a bit of clarity, and then we'll continue on. So the King's Fund and the National Lottery Community Fund programme, called Healthy Communities Together, aims to unlock the full potential of the voluntary and community sector in place-based partnerships to improve health and well-being. So if that's spiking your interest, definitely go and have a look at that as well.
Yeah, so that's probably a third important difference that I missed, that their programme is specifically focused on place-based approaches, whereas ours is a bit more flexible to both place and population and condition-focused approaches. Okay, I think that's the end of our FAQs.
Yeah.
So as I said, if you have any questions that we didn't answer, please get in touch. I'm now going to give a quick run through of the questions in our expression of interest form. So we've decided to keep the expression of interest form quite light. I think this is because we've had so much interest in the programme, and we predicted that, and we thought that actually at the first stage, keeping the burden on applicants small and focused would be helpful. So we decided to set an expression of interest form, which is composed of an ask for initial information about which organisations are involved in the partnership, and then 4 questions or statements to respond to, which are each requiring answers of up to 200 words, around 200 words. So it's quite a short application form, and we'd encourage you to think about how how that looks from the assessor side, and really try and be as focused and clear in your answers as possible. So the first question in the form is one we've talked about in the assessment criteria section, but it's about what healthcare challenge you're looking to address, and what you hope to achieve through the Common Ambition programme. So I'll just give you a couple of key tips on this one. They're listed at the bottom. But the first is, again, reiterating that this is about healthcare service improvement, and that whilst there may be other services involved in the programme, so from outside of the NHS and within the community and voluntary sector, the core of the proposals has to be around identifying the need to improve a particular healthcare service or set of healthcare services, and how the contributions of other types of organisations can help improve that service. The second is that this is a 2 to 3 year programme, and that we fund a lot of programmes of a similar length, and so we have a pretty good idea of the types of things that can be achieved within that time. And as an assessor, I think one of the things we really look for is for proposals that are really clear in what is achievable within those 2 to 3 years, and then are looking to also describe what they can achieve beyond the programme. So what's the aim for their partnership look like in future?
Yeah, so you may have a kind of really broad overall goal of what your partnership's hoping to achieve. And so thinking about working back from that and what specifically you can achieve within this programme in the 2 to 3 years with funding and support that's available. So although you may have a much larger, much more ambitious goal, it's kind of being able to give clarity on that. So sharing that overall ambition and goal, but then also being really clear about, and therefore what can we achieve through this programme to get us on the way to achieving that goal. So it can be a part or a phase of a much larger piece of work, for example.
And then finally, another nudge, just to say that we are really interested in inequalities through this programme. So thinking about which members of the public you'd really like to change services for and think that could benefit most from the work that your partnership's doing. Second question in the expression of interest form is really about that co-production piece. So we will only fund partnerships where the involvement of members of the public throughout and the contributions they're making alongside healthcare professionals is absolutely essential to the work that they propose. And so in your expression of interest form, you need to make a really convincing case as to why your proposals just wouldn't work without the contributions of members of the public. So it's a really fundamental question for all of the partnerships, and quite a tricky one to answer, we appreciate, but this is really the key to the programme. So a couple of key tips again here. The first one I've just covered, so focus on making sure that how you describe the proposals that you get across the public's input is absolutely essential. And also think about how, as a partnership, you're looking to establish a different way of working and a long-term behaviour change that can enable all of your organisations to work better with members of the public. And don't just think about how you'll involve members of the public in co-designing initial ideas or in, at the end of the programme, testing the findings of members of the public. Yeah. And so the third question is really tying into some of the information Rosie gave earlier about the partnership or the structure of the partnerships we're looking to fund. So we're asking about what the partners involved in your partnership hope to learn from each other, and what approaches they'll take to actually deliver the change that they're aiming for. So this is really thinking about what each organisation's bringing to the table in terms of knowledge, skills, and connections within local systems and to the communities that you're based in, and thinking about how the organisations involved are complementing each other. And the second part of that question is really about the practical details, is how you'll actually work together to deliver your proposals. And we're expecting that partnerships will apply an evidence-based approach to tracking and delivering change. So think about which approaches will make sense to use across your partnership.
Yeah, so what kind of improvement methodology you might be using is potentially something you might cover here as well.
Right. And then the final question, again, picking up on the sections that Rosie has talked about, is about how your partnership will use measurement and evaluation to develop the work and understand impact. So Rosie has covered a lot here, so I'll keep it fairly brief, but I'd really advise that you look at the measurement and evaluation section of the assessment criteria to get a sense of the type of evaluation work that we're interested in and the scale of it. So a first quick tip will be that your measurement and evaluation work will need to be well integrated with the delivery of the work. So we're looking for formative evaluation activity that will help the partnership improve its ways of working and measure change and impact as it progresses. And the second tip I'd say is to consider the scale and depth of the activity and the ability of your partnership to actually deliver on research and measurement activity worth between 10 and 30% of the total grant amount. And if that is potentially an issue, how you will look to bring in another learning partner, such as a university or a research organisation. And the third thing, just to pick up on around the evaluation, is not to forget with the measurement and evaluation activity that the public need to be involved here too. And we think that making sure that the findings of the measurement evaluation activity are really accessible, but also that the research questions are being co-designed with members of the public, and that the public are absolutely and throughout engaged with the measurement and evaluation work. I'll quickly cover what we don't require in the expression of interest form. So a detailed budget breakdown, we're not asking for any budgetary information at the expression of interest phase, and that will come later at the full application stage if we invite you to progress to that stage. Secondly, we understand that not all of the partners are potentially confirmed at this stage. So whilst we expect you to have your core voluntary sector and community sector organisation and your NHS organisation or organisations confirmed in the expression of interest, there will be an opportunity potentially to add further partners if interested once you progress, and if you progress to the full application stage. And finally, that we're not allowing any attachment of supporting statements or other supporting documents to the expression of interest form. So be aware it is just the 4 questions that you'll be answering about about your proposals. So try and be as clear and concise as possible in those 4 answers. After that?
Yeah, so just kind of reiterating that we won't be having the supporting documents. So make sure that you're not leaving the assessors guessing or trying to fill in gaps of the questions that you're answering. So yeah, a kind of good tip is to ask someone who's not involved in your work to read your expression of interest before you submit it. Make sure that they really understand what you're trying to achieve through this without any other supporting information. So there's a bit of a tip there. And then also just to reiterate, the expression of interest is just those 4 questions, so it's very short. And then just to say again, we'll still be using the same assessment criteria that are shared in the call for applications, that we will be being proportionate to the amount of information that you're able to provide. So make sure that you're concise, have your key points so they're easy to understand. And as I said, you're not leaving the assessors trying to fill gaps or not leaving them guessing as a top tip.
Final section. Okay. Just a quick overview on the application process in full and how to register on our application system. So we're open for expressions of interest now, and we will close on the 20th of March at 1 p.m. So expressions of interest must be submitted on our application portal by 1 p.m. on the 20th of March in order to be considered. We'll then go through the review process. We're expecting a lot of expressions of interest, so we're giving ourselves a decent amount of time to review them. And if we shortlist you, you'll be invited to submit a full application at the start of May. So we're expecting to invite around 10 to 20 partnerships to submit full applications. So we want to make clear that this is a competitive process and that we're expecting several hundred expressions of interest. So a much smaller number will be invited to submit detailed full applications at the start of May. Those shortlisted will have around 3 weeks to submit their full applications, and the full application form will be made available to those people in May and is not available at the moment. And we'll then consider those in another shortlisting process, but this time we'll be bringing in external assessors, so particularly thinking about how we bring in members of the public to help assess full applications, and also healthcare professionals and researchers to contribute to the assessment process. We'll then invite an even smaller number, so 6 to 8 of the partnerships, to attend an assessment day in July. So there are 3 assessment days. They're laid out in the call for applications guidance, and those assessment days will involve group activities which bring together the different partner organisations, and also an interview with a panel composed of Health Foundation staff and external reviewers such as members of the public again and healthcare professionals. And finally, we hope to announce the awards in late July. So you'll be notified of the final decision of the assessment process in July.
So just to say, we've, as Ollie mentioned, we've intentionally broken down the expression of interest and full application stage, and we hope that this process is quite developmental, as well as for the teams that are moving through to the announcement phase. They'll be gaining skills as they go. So we've been doing this webinar, and then we've had 2 events as well to help people really kind of develop their expressions of interest. And so each of the phases we hope will be development. So even if your partnership doesn't go all the way through to the announcement, that you're still developing and getting something from the process that will support your partnership in the long run.
And just a quick overview that in order to submit an expression of interest, you'll have to, first of all, make sure you visit our webpage and downloaded the full guidance, and you can also find an overview of the expression of interest form on the webpage. Secondly, you'll need to register on our application portal, GrantFlex. It's a pretty easy registration process, but be aware that there may be a slight delay of up to 10 minutes or so in terms of registration confirmation being sent to your email address. So hold tight, the registration confirmation should be coming, and let us know if it doesn't, but we've not had any problems so far, so fingers crossed. And again, reiterating that you'll need to submit the expression of interest on GrantFlex by 1 o'clock on the 20th of March. If you have any questions about the application process, or in fact anything you've heard throughout this webinar, do get in touch on our programme email address, which is commonambition@health.org.uk. But please be patient with us. We're getting a lot of inquiries, so we might not be the fastest at responding. And finally, a big thank you.
Yeah, so just thank you for everyone who's shown their interest in the programme. It's always really lovely, really fantastic to see the amount of engagement that we're getting. So yeah, we're feeling really good about this. So and thank you for your time today to listen and find out more about the Common Ambition programme and some of the practicalities about how to apply. Hopefully we've answered your question, but as Ollie said, if you still have any questions, do get in contact. But yeah, we're looking forward to reading your expressions of interest.
Yeah,
so
thoroughly excited.
Yes, we'll see you soon. But thank you very much.
Thank you very much.